Good morning. I am Dr. Milind Patil. I am an orthopedic surgeon. I am a director of Revival Bone and Joint Hospital, and we practice mainly knee arthroplasty. In a span of about 1 year, we perform up to 900 to 1000 total replacements in this hospital. We came across this IIT Bombay based startup, AlgoSurg's, and they introduced themselves with their new product of patient specific instrumentation, the newer X3DPSI, and I was very much impressed with their product. The group of engineers from the startup, they come to the hospital, take specific X-rays of the patient pre-operatively by putting their tracers and sensors, and they create a 3D model out of this X-ray. Now, if this model turns out to be really accurate as compared to the anatomical model, then you can do a lot of things on it. You can design jigs on it, you can measure sizes, you can think about the rotation and the angulation. This product basically is different from the old-fashioned or original PSIs, which were actually based on either an MRI or a CT scan. As opposed to that, this is based on X-ray, which first of all reduces the cost. Secondly, it increases the reach. Almost everybody has an X-ray machine, so doing an X-ray is not a big deal. Thirdly, it also reduces the turnaround time. That means assessing the X-ray, making a 3D model from the X-ray, and preparing a jig is much faster as compared to the previous few PSIs that we have used. First of all, the step of drilling this particular bone, what we have to do conventionally, is taken away. As it is taken away, the risk of fat embolism goes down. Secondly, if this jig is accurate, it will save a lot of time of the surgeon. First of all, at the moment for accuracy, we are doing conventional instruments. We are using navigation, which is costly and takes a lot of time. The robotic also is very costly and takes a lot of time. But if this jig is accurate, it will take away the risk of fat embolism and make the surgery very, very fast. Presently, we are doing a pilot study where we are actually comparing the jig that they have designed. We are putting a cutting block according to this jig and comparing it on the C-arm X-ray machine during the operation to see whether the angle that the desired angle that we wanted is coming or not. And I'm very impressed. The procedure looks very promising, and we are doing a pilot study just now, and once we complete about 500 patients, I think we will have real authenticated report for this. I wish them good luck. I think it's a very good idea because it is going to save time, save money, and obviously going to be more accurate.